A deterioration in mental functions, including memory, thinking, and reasoning, is referred to as dementia. Although anyone can experience it, older folks are more likely to do so. Numerous conditions including Alzheimer's disease, stroke, Parkinson's disease, and brain injuries can result in dementia. It may have an impact on a person's behavior, mood, everyday activities, and communication, among other areas of their life. Some symptoms of dementia are easily recognized, like memory loss, disorientation, or trouble speaking. However, some of the symptoms are more subdued and can take a while to become apparent. These are referred to be dementia's silent symptoms. The term silent symptoms refers to symptoms that don't clearly bother the sufferer or others close to them. Although they could appear to be typical aging or stress-related changes, they might also be signs of a brain problem and a need for medical intervention. We'll be revealing 8 silent dementia signs in this video that you should be aware of. Number 1. Changes in personality or mood. This implies that the individual can behave in a different way or experience abrupt emotional changes. They might, for instance, become more agitated, nervous, melancholy, or indifferent. They might also grow less interested in activities they used to enjoy or retreat more from social interactions. Damage to the brain regions in charge of mood and personality may be the source of these alterations. They may also be brought on by anxiety, dissatisfaction, or confusion brought on by memory loss or other cognitive issues. Number 2. Difficulty with complex tasks. This indicates that the individual can struggle with assignments that call for organization, planning, solving problems, or multitasking. For instance, individuals can have trouble following directions, handling money, or operating a vehicle. The brain regions in charge of executive functions, the mental abilities that assist us in organizing our thoughts, setting priorities, maintaining attention, and restrain our impulses, may be injured. Dementia-related decreased attention span or concentration may also be the cause of them. Number 3. Trouble with spatial awareness. This suggests that the individual can struggle to judge sizes, forms, direction, or distances. For instance, individuals might trip over objects, become disoriented quickly, or struggle to understand graphs or maps. Damage to the brain regions responsible for processing spatial connections and visual information may be the source of these issues. They may also be the consequence of age-related or other conditions-related vision or hearing impairment. Number 4. Language difficulties. This indicates that the individual can struggle to find the right words, comprehend what other people are saying, or clearly explain themselves. For instance, they might speak incoherently or vaguely repeat themselves or use the incorrect word. Damage to the brain regions involved in language production and comprehension may be the source of these issues. They may also be the outcome of dementia-related memory or attention deficits. Before we move on to the next fact, if you have enjoyed our video thus far, subscribe now and hit the notification bell to get updates about health and wellness. Number 5. Changes in sleep patterns. This indicates that the patient can experience difficulties going to sleep, remaining asleep, or waking up. Additionally, they could notice shifts in their sleep pattern, such as sleeping longer during the day and shorter at night. They might also experience nightmares or vivid dreams. Damage to the brain regions responsible for controlling sleep and circadian rhythms may be the source of these alterations. They may also be brought on by pain, worry, sadness, or adverse drug reactions from dementia or other illnesses. Number 6. Loss of smell. This suggests that the individual might have trouble identifying familiar smells or smelling objects. They might not detect smells, deterioration, or burning, for instance. Damage to the brain regions linked to the olfactory system may be the source of this symptom. The sensory system that enables us to smell objects and connect them to feelings and memories is called the olfactory system. Remember that allergies, illnesses, age, and nasal congestion can also cause a person to lose their sense of smell. Number 7. Changes in appetite or taste. This could indicate that the individual has distinct tastes in food and beverages or that they eat more or less than usual. For instance, they can have a craving for spicy, salty, or sweet foods. They could also completely lose interest in food or neglect to eat. Damage to the brain regions that regulate appetite and satiety may be the source of these alterations. They may also be brought on by changes in taste, smell, mood, or drug side effects brought on by dementia or other illnesses. Number 8. Lack of insight. This implies that the individual could not be aware of their dementia or the deterioration in their abilities. They could also downplay or ignore their issues, or they might put the blame elsewhere. For instance, they can maintain that everything is okay, they don't need assistance, or someone else is stealing their belongings. Damage to the brain regions responsible for reality checking and self-awareness may be the source of the symptom. Dementia-related anxiety, shame, or denial may potentially be the cause. What should you do now if you have these symptoms? Don't overlook or write off these quiet dementia signs as a normal part of aging if you observe them in yourself or someone you care about. This can indicate a serious illness that requires diagnosis and treatment. If you liked the video, give it a thumbs up and share it with your friends. Let us know in the comments down below. Did you or someone you know experience some of these symptoms before? You might also want to check out the other videos in our YouTube channel. Just click or tap the videos below here. Thank you for watching.